Studies will show at least 60% of Americans have insulin resistance. I think that's far off.
I think it's more.
I think it's
Way
80
more.
to 90, including both of us, by the way. We have it. So when you combine GLP-1s or Tirzepatide with hormone balance, you're feeling great and looking great at the same time. Guess what else that promotes? Improved motivation.
Motivation.
You know what that's from? That's from Rocky, when Mick said that. What do you call it? Motivation? So motivation skyrockets.
Welcome to Look Good, Feel Good with Matt Amy McKinlay, the podcast where we bring you expert advice and honest real talk on health, wellness, and feeling your absolute best. From hormone optimization to aesthetics and everything in between, we're here to help you live your best life. Let's dive in. Welcome back to Look Good and Feel Good with Matt and Amy. I'm Amy.
Hello, and I'm Matthew.
So today we're going to be talking about insulin resistance, GLP-1s, hormone testing. We're going to talk a little bit about that. It drives obesity. It's type 2 diabetes, heart disease, PCOS, fatty liver, dementia,
circulation,
and everything. And what's scary is insulin resistance becomes elevated decades before your glucose levels even start to rise. That when we evaluate patients, we look at a lot of different things. We rerun a hormone panel that includes thyroid. We look at testosterone, we look at your HbA1c. Your hormones drive how to process fuel and burn fat, and they're all connected in that. So anyway.
Yep. Most people are told, hey, congratulations, your A1C looks fine. Well, it might look fine, but insulin resistance can start years before it affects the hemoglobin A1C.
Yeah.
So what happens is insulin has a hard time getting into cells, so it accumulates in your blood, okay? By the time it accumulates to a great amount in your blood, which raises the hemoglobin A1C, the damage has already been done. So we want to catch this stuff early and get on it early. So if you're starting to have symptoms like Amy mentioned earlier, don't wait. Get in and get things looked at before you're in bad shape and it's harder to repair.
Yeah, it's one of those things where I always tell my patients, almost everyone's insulin resistance. And it's because we live here in America where we live in the land of plenty and we always have food around. Insulin is always around, and our cells become kind of lazy and they just don't take insulin, like they used to be. Insulin's job is to escort glucose into the cells. But when insulin is constantly elevated from frequent snacking, from stress, lack of muscle, your cells become lazy and they stop responding. And that's when insulin resistance starts to take place. And your pancreas compensates by making even more insulin because it needs to get glucose into the cells, and so it makes more. That's when we have like hyperinsulinemia.
Yeah, it's almost like a feedback mechanism where the body is producing more insulin so it can get into the cells, but those cells are almost locked with the insulin resistance. So it just keeps building up. So I think, and studies would show this is pretty accurate. Studies will show at least 60% of Americans have insulin resistance. I think that's far off.
I think it's more.
I think it's
Way
80
more.
to 90, including both of us, by the way. We have it. We've learned how to correct it. But here's why. And Amy touched on this, but the way we eat, the way we're raised on processed foods, guess what? Those foods become an addiction. Think about, I'm in my 50s. When I grew up, we ate a lot of good foods because my mom made us mostly organic, but other things that we ate, we'd eat some McDonald's. Man, every time you take a kid to McDonald's, they want to go back again. We would eat some cold cereal as a treat, but guess what? We would try to sneak it when my mom wasn't around so we could get more. Those are the foods and crackers and cookies. Those are the things that start this insulin resistance at a young age that we don't even realize. And now, if I did the same thing, we did the same thing with our kids. We raised them the same way. Things that are convenient, fast. We're starting insulin resistance at a young age. So we're teaching our kids now not to do it the same way with theirs. But now that the damage has been done, we got to fix it.
And this is where hormones come in. For men and women, we have low testosterone levels. And, that's why when we get men and women back on testosterone or TRT, it can be such a game changer, not for bodybuilding, it's for metabolic health for both men and women. And, when someone asks, why test hormones levels if my blood sugar is normal, it's because insulin resistance can happen long before you're diabetic. We kind of talked about that. That's insulin levels will start to rise before your HbA1c, which is looking at your blood sugars over a 3-month period versus just looking at your glucose levels. And so that's why we test. That's why we look at your thyroid. That's why we look at testosterone. That's why, we look at all of those factors and they all tell a story.
Yeah, the hemoglobin A1C, glucose, all of those things. It's like a puzzle that we put together. And if you can solve the puzzle early, boy, it saves a lot of heartache. Now, the way we test, and I want to explain why, we test our labs non-fasting. Now, if you want to optimize things on a lab, you can do fasting levels and it'll look better. But we want to see a true picture of why people feel the way they do. Not just manipulate labs so they look better. Maybe if you're getting insurance tests out there, manipulate your labs a little bit. Just a side note there. However, it's amazing to see non-fasting labs after people have been on a hormone optimization program for 6 months and how things change dramatically with insulin, glucose, heart health, testosterone levels, estradiol levels, progesterone levels, all the things that really help optimize our health and just feeling good. So when we get someone feeling great, we continue to test labs every 6 months to be safe, but we're treating the patient, not the labs at that point.
Yeah. So one of the fastest ways to lower your insulin levels, and we talk about this all the time with our patients, is what we call intermittent fasting. And intermittent fasting, or a ketogenic style type plan or diet, when you fast, your insulin levels drop. And, fat cells have to release energy because you're fasting during that time. And your body starts producing these ketones, which is a clean anti-inflammatory type fuel. And that's why so many patients feel sharper, they feel leaner. Finally, they're finally getting into a mild ketogenic state. So intermittent fasting, what that means is, for me, this is what it means. It's different for other people that sometimes have you have to work night shifts or something like that. But for me, I don't start eating until 11 a.m. So basically I'm skipping breakfast in the morning, and then I stop eating around 7:30 at night, 7:30, 8 o'clock. I mean, there's some times where I'll say it's okay, especially on vacation. Sometimes I'll eat breakfast and I'll kind of get out of the routine. But at the same time, that's the majority of the way I eat. So I'm producing a ketosis state, especially as I go into the nighttime and I'm sleeping. And then the next day, I'm not eating until 11 o'clock. And my body gets trained that way. And that becomes like a ketogenic state. And it helps to control insulin.
Yeah, and think about it on a simple formulation. When you eat, your blood sugar spikes. So if you eat a lot during the course of the day, like doctors' offices where people are snacking all day.
Like Matt sometimes you used to do that a lot.
Yeah, don't be throwing me under the bus. I've been intermittent.
I had to hide the M&Ms.
Yeah, who ate some licorice right before we started?
Well, it's past 11 o'clock, honey.
Okay. But that's not the best thing to start your fast after. So when your blood sugar spikes, insulin does as well. So if you're doing that throughout the course of the day, you're going to have a lot of spikes, and then it's going to come down. I hate the word fasting. So you can think of this as also a way to eat. Or people will ask me all the time, how should I do it? And I think a good rule of thumb is a 16-hour window of not eating and an 8-hour window of when you eat. So, for example, like Amy said, start at lunch and then end with dinner. But when you start your eating cycle, let's say it's at noon or 1 o'clock, you definitely want to start out with a good, healthy meal with lots of protein and maybe some good carbohydrates like vegetables or whole grain foods, eliminating what Amy just ate with the licorice.
I know. Sorry.
I'm just teasing her. But
it's true, though. The results are even better when we talk about optimizing hormones, not just about intermittent fasting, but when we optimize our hormones at the same time, like getting your testosterone levels to where they're optimized, your thyroid optimized, help, stress management, of course, is important. It all works together. And, there's another medication that has just, I don't know, not just recently, it's been out for about 10 years, are the GLP-1s that are all around. People are using them, and I think they're an amazing medication. We're talking about semaglutide, Ozempic, or Tirzepatide, Mounjaro, and there's some new ones, Retatrutide that's coming out. Is that how you say it?
Maybe. I'm not
I think
sure.
it's something like that. But because everyone's talking about them, here's how they work. So GLP-1 is actually it's a hormone that's made in your gut, or peptide made in your gut. And it signals your brain that you're full, to stop eating. And so people that are overweight, that are, obese, they're,
or even
insulin resistance, that signal, they don't have that signal anymore. The GLP-1 doesn't release very well anymore. And so it's not willpower, it's physiology. It's just those meds really helped reset that pathway. So that's why they work so well. We've seen such an amazing results with them, and we use them in a very, we don't ever go over certain milligrams, and they work very, very, very well.
Yeah. So the key with these medications, and I agree, I think it's the best pharmaceutical revolution that I've seen in my lifetime.
Well, and it's not just pharmaceutical. It's a natural. We're just giving you a little bit more peptide. It's a GLP-1, which you already make. Just giving you a little bit more.
Yeah, but it doesn't work when you have insulin resistance, and that's the key here, and that's why it's given.
Yeah.
And we've thrown some shade at Big Pharma, but this has been something I think has been done very well. However, it's not prescribed right in most cases. But what it does, it helps your body reset. Okay. So when we see people all the time that will say, hey, I'm eating good, I'm exercising, I'm doing everything I'm supposed to, but I see no results. I still feel lethargic, I can't lose weight, and it's kind of depressing. So we introduce GLP-1s and teach them how to use it, and we use Tirzepatide. Studies will show, and we definitely think it's the best one right now.
Lower side effects.
The next generation may be better, and we're going to have access to that for sure. But it really helps your body reset. So when you use this medication, it's done in an injection form, okay? You feel full much quicker when you eat. So a lot of times with insulin resistance, you just don't feel full. So people will say, man, I ate a meal and I still want more. I'm still hungry. Well, they're really not hungry, but that signal in the brain that comes from the gut is not turning off. So with these medications, it helps that signal, or a lot of people will call it the noise. It helps decrease that noise, the food noise, so they feel full, okay? The second thing it does is it really helps your body feel full longer. So as you digest your food, it slows down your digestion. So that's why it makes intermittent fasting so much easier too, okay? When you apply those two principles together, it's magical. The third thing it really does is diminish cravings, because a lot of times when we have insulin resistance, we have cravings. We want foods that we know are bad for us, and we want to, throw that into our body even though we're not hungry. Those aren't hunger issues. Those are craving issues. And Tirzepatide does a wonderful job at diminishing those.
Yeah. And so Matt talked about the GLP-1s, but we have we don't just say this is a magic weight loss medication either. There are some lifestyle changes too. So when we combine the GLP-1s, like Tirzepatide, with lifestyle changes like intermittent fasting, and we balance your hormones, get them, optimized to where you can feel good, you can maintain the results. You don't have to stay on the GLP-1s for, a lifetime. Sometimes we do what we call microdosing a lot of times with the GLP-1s, which seems to work very good for inflammation and makes people feel good. And because you can't, out-medicate a broken metabolism, you have to kind of try to teach it to work again. That's kind of what it's about. So,
yeah. So I'm going to talk about the balance, and this is where honestly the freaking magic happens. Is when you balance your hormone optimization with a GLP-1. These are our patients that see these massive transformations. So not only with weight loss, with obesity, with how they feel, the hormone balance just really does a wonder with, look at Amy's lean muscle mass, right? Yeah, look at those guns.
And we've talked about my story. I've lost 40 pounds on it. And anyway,
Yeah.
I feel amazing. I was insulin resistant. Matt's lost about 40, 50 pounds.
But she's put on muscle while she's lost fat.
Yeah.
And that is the key. That's the thing the hormone optimization does, okay? So when you combine GLP-1s or Tirzepatide with hormone balance, you're feeling great and looking great at the same time. Guess what else that promotes? Improved motivation. You know what that's from? That's from Rocky, when Mick said that. What do you call it? Motivation? So motivation skyrockets, okay? The other thing that skyrockets is confidence. And then you start to build this confidence of helping yourself, okay?
Yeah.
So you're not relying on the medications anymore because you have now reset and you're feeling like yourself again. And that's, again, the combination. Does it cost money? Yeah, it does. But I had a patient the other day say, if you don't do it, you're going to pay for it later with a heart attack.
Yeah.
Or something that basically may kill you or your lifestyle and the way that you live the rest of your life.
Yeah. So, here's the bottom line. Insulin resistance is reversible. Get a comprehensive hormone panel. We optimize your levels. We lower your insulin levels through nutrition, fasting, sometimes some GLP-1s, short-term use of those. But that's how you flip the switch from storing fat to burning it.
Yeah. And when that happens, everything changes. Mood, energy, anxiety, longevity. And that's the key thing here is longevity. Your quality time remaining, or your QTR, now changes. And there's a whole new outlook on life. And this is where we've been through the journey, and we've helped thousands of people through this journey now. And it's been amazing. It's changed the way we look at things.
Mm-hmm. So we appreciate you guys joining us today, listening to us. And if you have anything you want to offer, let us know.